I'd just like to ask in general, I suppose we're all aware that the first line of defence with this disease is surgery. But as you progress down the line and various other therapies, what's the experience in Ireland in terms of reopening surgery, let's say, where people who have had surgery in the past, and is debulking something that is done in Ireland at all or regularly, or is it considered? And I know it depends on each patient and whether they're able for it or whether there's a benefit to it, but where there's other disease involved other than liver, and maybe Per Helman would give a view as well in terms of what they're doing in Sweden in terms of debulking. Like, do we do debulking in Ireland where there's bone involvement, or do we do debulking in Sweden? And what experiences you have come across with debulking over the year and the benefits over the years and the benefits of it?
I just make the general comment that I think each individual situation is discussed at MDT with all the group. I think there's a pretty wide range of experience with, certainly with reoperative surgery in general. You know, the group of people that do all the liver and pancreas surgery do a lot of reoperative surgery in the non-NET group, and of course that experience transfers very usefully into the NET patients. So there are all kinds of different scenarios where that might be an issue. Quite a few patients who may present with small bowel primary tumours may have residual mesenteric lymph node deposits following their initial operation. And I think increasingly, as a group, we've tended to offer those patients reoperation to try to clear the mesenteric lymph nodes, and where possible to get those patients to a point where they have no detectable disease on scan. So I think that's very much the philosophy of our group, if I can use that term.
If you have a growing metastasis somewhere that is not responding to the treatment that you get, the surgery in the bones you were asking also?
No, I'm sorry, what I'm saying is if there is disease in other parts of the body, such as the bone, might that rule out, in your opinion, going back for, let's say, controlling maybe a tumour that isn't behaving in the liver?
It's also depending what type of original tumour it is. Let's say it's an insulin secreting tumour that creates low blood sugar levels. Then you need to control that maybe with surgery, even though there are bone metastasis presence in some situations. So it's depending on what type of original tumour it is and if something is responding or not responding to other treatments.
So it's specific to each patient in general, and it's not ruled out, but it depends on the patient?
Yes.
Okay, thank you.